Welcome to the Ashby Village Science and Ideas Group. My name is Joe Evinger, and I coordinate this group's events with the help of our co-host and tech expert, Hillary Naylor. All of our members here have very educational and work experience backgrounds, but we all share one common interest in science and ideas. Currently have over 60 members in our group and another on our guest mailing list. We meet via Zoom the second Thursday of every month from 3 p.m. until about 4:30. We have a different guest speaker each month who speaks on a topic related to science and ideas. And we rely on our science group members, all Ashby Village members, our invitees, presenters, and others about ideas for new speakers and ways to connect with them. Coming later this year, here are some speakers and their topics. On September 14th, Charles Tart, who's also a member of our village, is a retired professor emeritus of psychology at UC Davis, and he will make a presentation titled, and this is his title, Parapsychology, Go Home. It's too late, it's too dangerous here, you'll get killed. In October, Alicia Welsh will make a presentation titled Conservation of Vultures in the World. November 9th, there will be a presentation by Dr. Richard Schwartz, whose research has focused on understanding the mechanisms by which growth is both enabled and contained in our human bodies. On December 14th, Irene Kuhn will return to us to give a new talk on progress in her field of cancer vaccines. We are also looking for new speakers. If you know anyone, please recommend them to me along with their contact information. We invite all Ashby Village members to join our group. Others interested in Ashby Village and our presentations are also welcome. One quick commercial. Ashby Village is a 501c3. I asked Hillary to place a link to our website in the chat. Note to our guest, please consider a donation or even joining our organization via website. Special thanks this time to Sarah Evinger for recommending today's speaker. I'm going to ask Sarah now to introduce Martha Jones.
Hi, everybody. Martha Jones is an economist who's been teaching at Vanderbilt since 2013. Her current research is in occupational health, specifically work-related injuries and illnesses. Her research interests have spanned various topics over time, including California educational finance, her PhD thesis at UC Berkeley, and reports for the California legislature and executive branch while working as a researcher for the state of California from 1999 until 2013. She taught economics and statistics in the San Francisco Bay Area and in Geneva, Switzerland from 1995 until 1999. Previous employment included positions at the Federal Reserve Banks of Philadelphia and New York, as well as at the United Nations Economic Commission for Europe in Geneva, Switzerland. She enjoys spending time with her family and traveling, as well as playing tennis and her viola. As an aside, I have to say, two of Martha's children sang in my youth choir some years ago, and it is Joe's and my great pleasure to offer Martha Jones to you today to speak to us.
Okay, so I guess I share my screen, right?
That's you.
Okay. How do we? Okay, there we go. Does everybody see that? Is that okay?
Yes.
All right. So I'm going to be talking about economic demography today, and it's an area of study that examines the determinants and consequences of demographic change. And actually, I got to get rid of myself here because I can't see these slides. And this demographic change can also basically influence the economy. So I'm going to be thinking about demographic influences on the economy. Another talk would be economic influences on demography. So it's so the causality kind of goes both ways. I'll start talking, describing population trends, and then move on to three concepts: the demographic transition, the demographic dividend, and the economic life cycle. that will help us sort of understand how population aging fits into economic growth. And then I have two examples, one using the gendered economy, older women working as unpaid caregivers, and also Social Security, the fiscal effects of population aging. So population growth, which basically is determined by fertility, mortality, and migration. However, if we're thinking about the world population, it's actually fertility and mortality because we don't have any migration from the moon or anything. You can see that since 1950, we've had very steady population growth, but starting about 2040, 2050, it's projected to really level off. So world population growth continues to grow, but the pace of growth is slowing down. The higher and lower estimates are due to higher and lower estimates of fertility. If you look at different regions in the world, this slowing down of growth or flat growth is prevalent in all regions going forward, except sub-Saharan Africa, which is projected to sustain rapid population growth all the way to 2100. So that's a bit of an outlier. Also this year, India's population is now estimated to exceed China's. So that's a big change. In terms of fertility, it has been declining since about 1970 in most regions and in the world in general. However, again, you see in the purple here, South Africa, sub-Saharan Africa, sorry, didn't start declining until more like 1990 and is still much higher than in other areas. Life expectancy, it's been growing everywhere. You can see, however, that again, this purple is sub-Saharan Africa, which is a lot lower. You can also see that it sort of went off course here and starting in about 1990, and that's because of the AIDS epidemic, which really cost them about 2 decades of growth. The other big jump here, this decline, is in China due to the Great Leap Forward and the famine in those years. Actually, I should also say that you can see COVID here. This drop here is basically COVID. So when we think about population change, we think about the components of change, which are natural increase, the surplus or deficit of births over deaths, and net migration, which measures inflows minus outflows. So to figure out population next period, you take population in this period, the first period, you add natural increase, you add net migration, and you get population the next period. So this shows the contribution of natural increase and net migration to various income levels of countries in the world. And the bars are the amount of population change, millions of people. The yellow is net migration, and the green is trends in natural change, births over deaths. So what you see is in upper middle income countries, low income countries, and lower middle income countries, what is driving population change is natural increase. In all cases, in all of these 3 cases, basically migration doesn't matter or is negative. The difference is in high income countries up here on the upper left, where natural increase is decreasing quite quickly, starting in 1970 or so, and immigration has increased recently. They cross in about 2005, and immigration is now basically, starting in about 2020, the only thing that's keeping population change positive in these high income countries. This is the same analysis in different colors, but this time in regions of the world. On the right, and slightly different, like I said, different colors. The blue now is net migration. So Latin America, Asia, and Africa, all of those migration is not is either negative or flat. The difference here, I just wanted to point out really is Europe versus Northern America. So Europe has had negative natural increase since about 1990. The cross and immigration is the only thing that is basically keeping population up at all, but population change in the last few decades, well, actually in the coming decades is looking negative here. In Northern America, it's not quite as extreme as in Europe. However, we also have a crossover where immigration is a bigger influence than natural increase on population change. And these are just the sort of sample charts for the US. Sort of looks the same as the world, increase in population until about now, which is about 350 million people. And then in the next 75 years, only an increase to 400 million. So real flattening out of our population. Again, this is using the median estimates for fertility. If you look by broad age groups, the thing that stands out here is this huge increase in 65 and over. So that's population aging. Looking at the components of change, natural change and net migration, you see that let's just start in about year 2025, we have very declining natural increase. In other words, births are lower than deaths. And it's only immigration that is keeping up our population change. This is estimated about 1 million persons per year. And of note is that the group in the US that has the highest fertility is Hispanics or Latinas. So if immigration is cut from Hispanic countries, it will not just be immigration that's cut, but also our fertility rate will probably be affected. So moving on, let's now think about the demographic transition. So this is the idea that before a country or region enters this transition, fertility and mortality are both very high. After the transition, they're both low. But what's quite interesting is the transition, because mortality usually declines before fertility. And this is because of better healthcare and medicine, and there ends up being quick drops in infant and child mortality in many cases. So population growth accelerates at first due to mortality declines. And then after that, fertility begins to decline. And in that case, then population growth rates start to move down towards zero and maybe even go negative. So this is the stylized demographic transition where you have high birth and death rates and very basically low or no population growth. But when death rates fall, population growth increases until fertility starts falling. And then the growth rates decrease and you end up in the end of the day with low death rates and birth rates. So I'm going to sort of run through this on a stylized demographic transition using India as an example. This is from an article by Ron Lee, who's a professor at Berkeley. So India in life expectancy began to rise in India in about 2000. And the asterisks here are actual data and the zeros are projections. So that's life expectancy, and which is basically meaning falling mortality. And then fertility began to drop around 60 years later. Here assimilated from 6 to 2.1 births. 2.1 is replacement level fertility. So now what we're going to do is think about changes in the age distribution that are a result of these changes. And we're going to use dependency ratios to describe the economic life cycle and the demographic transition. So here we're going to sort of enter economics into the story a bit. This is the picture of the economic life cycle. You can see in the chart, the red is consumption over different ages, and the blue is income. And there are two periods of dependency here, one in childhood where you're consuming more than you're producing, and then one in the older ages where again, you're consuming more than you're producing. And then in the middle, you have these working ages where income is higher than consumption. So this is actually from the National Transfer Accounts Project, which is about understanding the generational economy. In other words, how we produce, consume, share, and save resources by age. This National Transfer Accounts is a global research project with teams in over 70 countries working to understand their generational economies. Many of these research teams are based in universities, others in think tanks, research organizations, government statistical offices, and NTA estimates are produced for about 185 countries. This project was begun by two economics professors from the US, Ron Lee at UC Berkeley and Andrew Mason at the University of Hawaii and the East-West Center. These are two economists whose careers have focused on understanding how populations affect economic outcomes. So this life cycle pattern of consumption is supported by large flows of economic resources between age groups. And this is through markets, through families, and through government transfers. Population aging changes the shares of people in each age group, impacting these aggregate economic flows and also average productivity. So what we're going to think about here is using first dependency ratios. So those are just based on age, based on 3 life cycle stages, youth, old age, and then working ages. So the youth dependency ratio is, in this case, less than age 15, over 15 to 64. The old age dependency ratio is 65 and over 15 to 64. And the total dependency ratio adds the 2 dependent groups together in the numerator over the working ages. So in some sense, you're looking at net consumers over net producers. The second concept is the support ratio, which is actually the reciprocal of the dependency ratio, which can be kind of confusing, but anyway, and that is effective workers over effective consumers. So by effective, we mean so we're not just going to be counting number of people here. We're also going to be taking into account labor force participation, hours worked, unemployment, and wages. So, I mean, a quick example for what an effective worker might be, for instance, if you have one person working full-time all year, that's one effective worker. If you have 2 people each working half-time, that is also one effective worker. So these other variables are going to enter into the computation of effective workers and effective consumers. So how this changes over time? Well, first we have a drop in infant and child mortality, which began to decline in the early 1900s for India. So that is going to increase the youth dependency ratio. Then later, the fertility starts to decline. So decrease in the youth dependency ratio, and it can be actually dropping kind of rapidly depending how quickly fertility drops. The old age dependency ratio is different. Serious population aging doesn't begin for more than a century after the transition starts, but then can again start rising very rapidly by a factor of 5 or 6, for instance. So this period right here is called the demographic dividend, and it occurs during the period of declining total dependency ratio. Here it's about 60 years. in the simulation for India, and it adds 0.5% of per year growth in per capita income. So this is the period where you have more effective workers per effective consumers. And there's economic growth, and that gives us opportunities for investment in both physical and human capital being investments in education, for instance, and better health. However, when population aging starts to set in, it increases the dependency ratio. This sometimes is referred to as a negative dividend. And in the end of the day, we can end up at sort of the same level that we started out at. That's just a simulation, not clear that that will actually happen, but that's how this looks. So here we have the levels, same at the beginning and the end. So this effect of the demographic transition on the total dependency ratio is transitory. And also this demographic dividend only lasts for a certain amount of time when you have more workers sort of per dependents. And then this chart over here on the right just puts all of these together. So this is the total dependency ratio on the top, and you see the youth dependency ratio here and the old age dependency ratio there. So a little bit more information on this demographic dividend. That is the importance of demography to economic growth. And the role of population in spurring economic growth isn't population size, but it's actually age structure. That's the kind of thing to understand. The demographic dividend is the accelerated economic growth that may result from a decline in a country's mortality and fertility and a subsequent change in the age structure of the population. With fewer births each year, a country's young dependent population grows smaller in relation to the working age population. With fewer people to support, a country has this window of opportunity for rapid economic growth if, and this is capital if, the right social and economic policies are developed and investments are made. Examples of countries where recently this has happened is China, Thailand, South Korea, Ethiopia, and Rwanda. So demographic dividends show how population impacts living standards. The dividend we've been talking about is this, what we're going to call the first dividend. It's the growth in the working age population relative to dependence as mortality and then fertility fall. And it's basically transitory unless it's invested to really enhance future growth. So you have this growth in economic output, but what policies are put in place are going to matter in the long run. You know, if the increased product or the increased output is used on parties for leaders and building palaces for leaders and that kind of thing, that's not going to give the same long run boost to the economy that it would have happened if, you know, you had invested in education or roads or better health or whatever. So policies really matter in this case. But however, there's a second dividend, and this second dividend has to do with population aging. And this is because older persons often hold more assets. An older population facing an extended period of retirement has a powerful incentive to accumulate assets. And if these assets are saved, then that favors what we call capital deepening. In other words, more capital per worker, and also more human capital investment that can increase productivity and consumption per effective worker. So this will happen, but it sort of depends on how retirement is financed. If it's financed by people saving, then you've got this accumulation of assets. If it's financed by family transfers, or if it's financed by government transfers, then you're not going to have the same kind of asset growth. And then there's also this, sometimes this is called the silver dividend, the potential for more dividends from enhanced productivity of older workers. And we'll be talking about this a little bit later In other words, many workers who are not in the labor force are still contributing a lot to their communities and to the economy. It just is not counted in the same way. So dividend outcomes are not automatic, however. This first dividend yields a transitory bonus, and the second transforms that bonus into greater assets, but depend on the implementation of effective policies. Thus, the dividend period is this window of opportunity rather than a guarantee of improved standard of living. These dividends are sequential, but they also overlap. And there have been estimates of the size of these dividends in all regions. They've had positive effects, except in sub-Saharan Africa. So here's China as an example. After the revolution in 1949, Mao was very interested in improving the health of the population, had all sorts of initiatives, including barefoot doctors. And the result was a very marked reduction in infectious disease and improvement in infant and child survival. So that's your decrease in mortality. However, he was extremely interested in having a high population, high population growth. There was this patriotic national motherhood campaign. So fertility remained high. Then you had the Great Leap Forward and the famine, where millions died. But after that was recovered from in the 60s, birth rates rose again. So it wasn't until the 70s that birth rates fell, and this was largely due to the one-child policy and also sterilization policies. So what this resulted in was a very large first demographic dividend. So they had reduced fertility, they had few children, and disproportionately large number of working age adults ready to take low-wage manufacturing jobs. There were domestic free market economic reforms under Deng Xiaoping and human capital investments in education, especially. There was an enormous impact on economic development. China's economy grew at about 10% per year for decades. Millions of people were lifted out of poverty. There was also the good luck and good timing, because there was a supportive global economic and trading environment. So participation in global supply chains was super important. Again, the demographic dividend is not destiny. The demographic transition is not a guarantee of economic growth, but when the right conditions, it certainly can have that effect. So these are really neat graphs from the NTA, Gretchen Donauhauer. This first set looks at 1960 to 2020, and this is looking at these dividends. So we have these different areas of the world: Europe and North America, Eastern Asia, which is basically China, Latin America and the Caribbean, Southern Asia, which is basically India, and then Sub-Saharan Africa. So here we're looking at the first dividend here, which was positive in this time period and only started population aging, sort of negative dividend, close to 2020. Eastern Asia, this is China's huge first economic dividend and only slight beginnings of population aging. Latin America, very large first dividend. Southern Asia, which is India, a large dividend and hasn't come to an end yet. And Sub-Saharan Africa only just starting, basically. They're very, very delayed gains there. So now we add basically 2020 to 2070, and you can see the results of population aging here. In Europe and North America, also in Eastern Asia, Latin America, some results of population aging. Southern Asia, not so much population aging yet. They're still in the first dividend. And Sub-Saharan Africa, according to this, will start entering and possibly, if the correct policies are pursued, they will, the first dividend will be positive in the foreseeable future. So this is kind of a convergent role between, the first dividend is playing this convergent role between these different regions. Opportunities for the demographic dividend. Well, again, this shows the percentage of population in broad age groups for the world and by region. So the orange is age 0 to 14 and the blue is age 15 to 24. What stands out here is Africa, 41% 0 to 14, 19% 15 to 24. So basically 60% of the population is under the age of 25. This clearly is ripe for the first dividend. However, common misperception among many leaders is that a large youth population itself is an indicator of a coming demographic dividend, which, as I've said now many times, is not necessarily the case if the right policies are not pursued. So let's think about now how much does population contribute to GDP growth? So we're going to, again, think in terms of this economic life cycle. And GDP growth is a function of population growth and productivity. And we're going to think about population growth as growth in the number of effective workers. Productivity growth is the growth of GDP per effective worker. And until recently, effective labor grew in countries with both high and low labor productivity, which contributed to record growth in GDP. However, effective labor is now growing in countries with relatively low labor productivity, but declining in countries with high labor productivity, like high-income countries. So the contribution of population to GDP growth will be much less in coming decades. This chart is also from the NDA project and is discussed in this article, 6 Ways Population Change Will Affect the Global Economy. The blue in these charts is the contribution of population, which is measured by effective labor, weighted for different countries, because we're adding all these countries together. And then the orange is productivity growth. And what you notice here is that the period 1975 to 2000 is really different from the others in the sense that population growth was really important. About more than half of GDP growth was really because of the growth in population. But going forward in 2020 to 2060, for instance, it's a very minor role. So what other things are happening in this new environment of lower fertility is that since women are having fewer children, they can redirect their time and energy to other pursuits, including more education, more work in the formal labor market, production of market goods and services, and also perhaps spending less time with their children, but perhaps spending more quality time with their children. Small families are investing more per child in human capital, and this is investing both in health and education. The next graph looks at this, it's just an association. Greater investment in human capital per child is associated with lower fertility. So on the x-axis, we have the total fertility rate, all the way up to 7.5 children per woman. And on the y-axis, we have human capital spending. And this is, as explained over here, a synthetic, calculated as the sum of public and private education spending, public and private health spending, expressed as a percent of pre-tax labor income of persons 30 to 49. And what you notice is it is a sort of negative relationship here. The higher the fertility, the lower the human capital spending. and also these low human capital spending countries with high fertility are mostly in sub-Saharan Africa. This more human capital spending will be good for children, but it also gives parents the ability to maintain support for older generations as population aging occurs. So again, if we're thinking of population growth is a function of two things, the growth in effective workers and productivity growth, how can we increase these two categories? One is just increasing the quantity of labor. And one way to do that, these are just examples, would be delaying retirement. A second is increased female labor force participation, sorry. In a lot of the world, females could participate a lot more than they currently are. And even in the United States, it would be helpful if we had things like parental leave and better, affordable childcare, things like that. Immigration is another option. Other strategies are greater investment in human capital, which will increase productivity growth. Improvements in capital and labor markets to make it easier for people to work and invest. And then finally, reducing costs in healthcare. So those are all strategies for increasing these two resources. Another way to think about this is reforming our reallocation systems. So here we're sort of thinking about pensions, and in particular in the US, this would be Social Security. So the first bullet point is transfer systems more in balance with population to be sustainable. Currently, because of our fiscal challenges with Social Security, it is not sustainable at the current level of benefits. And then the second is thinking also about encouraging these asset-based systems. In other words, encouraging people to save partially, not necessarily for their entire, for all their retirement expenses, but partially to increase savings would increase these opportunities for a second demographic dividend. So again, thinking about the female labor force and reducing gender gaps, that would be a relatively painless way to enhance labor market productivity. And some of this is happening anyway with sort of cohort change. In other words, younger women today in most parts of the world have many more opportunities for education and work than older women, did 30, 40, 50 years ago, 60 years ago. However, the point I want to start talking about here is that not all work is market work. There's a lot of unpaid care work that is a part of our overall efforts, and it's mostly done by women. And a lot of it is actually done by older women who are particularly productive in this unpaid care work sector. And I'd like to sort of highlight their contributions and also their vulnerability. So far we've just looked at market labor force as we measure it in our national accounts for GDP. This is hours per week worked by age. And that's market labor is what is counted. However, there's more to production than just market production. There's all this unpaid care work. And this has been a lot of work done by Gretchen Donahauer and others at the NTA using time use diaries. For instance, in the United States, we have the American Time Use Diary. And an amazing amount of effort has been put into this, looking at not just direct care for persons, but indirect care through housework. We know that GDP is not a perfect measure of work performed or well-being. It doesn't include the value of almost all activity that takes place outside of markets. So caregiving, housework, students, yard work, whatever is, not paid and on your W-2 and things like that. It doesn't account for other things that increase well-being, like leisure, quality of the environment, health, informal and underground economy, and also doesn't take into account the distribution of income. So it's definitely an imperfect measure. These are some amazing graphs about time spent in market work and time spent in unpaid care work, and in a bunch of different countries. So let's look on the left here at time spent in market work. The average time for women is shown in the solid lines and for men in the dashed lines. So in the market, and let's just look at Bangladesh, which is the top left corner, and the United States, which is the bottom left corner. And you can see that it's in Bangladesh, it's men working in the market and women not so much. In the United States, these two profiles are much closer, but women are still working fewer hours per week than men. In terms of unpaid care work, you can basically flip the profiles from market work. So in Bangladesh, you've got women working in unpaid care work and men not so much. In the United States, they're quite close, but still it's women doing more than men in this space. And you can see this bump among young women taking care of young children, and then also older women. Who is the greatest consumer of the unpaid care work? So this was trying to get at, whether it's the elderly or whether it's children. And in fact, it seems to be children in most of these cases. Lots of spikes here among the young ages. And there's some sort of increases in the older ages, but not these huge spikes. So that would be young women taking care of young children, but it's also older women taking care of their grandchildren. So this is looking at net unpaid care work transfers, which is consumption of unpaid care work minus production. And you can see that for females in these, this is just Asian countries, actually, you can see that it's negative for females. So they're producing more than they're consuming, whereas for men, it's pretty equal. So what do these patterns mean for older women? Older women's contributions can go unrecognized because they specialize in this unpaid invisible care work sector. Obviously, one solution would be to produce some statistics that include this work. Specializing in this sector also has vulnerabilities. It's outside of any social protection schemes. It's certainly, there's no unemployment insurance for unpaid care. It can also be debilitating for caregivers. And some solutions here would be, again, to include unpaid care work in some of these protection schemes, provide supports for family caregivers, and also for when caregivers become a care receiver. So that's kind of some thoughts on this sort of mitigating factors of population aging. In other words, there is a lot being contributed by older people. It's just not counted the way we count it. And then finally, thinking about the fiscal effects of population aging, I'll have a few comments here on our Social Security system. So Frances Perkins was the person who was assigned by Roosevelt to develop policy for Social Security in 1935. She was the first woman ever to serve in a presidential cabinet. This is like top 10. This is just I'm going to just have a couple slides here on background. I know that lots of, in this group, people are very familiar with Social Security. It's a retirement program or pension program, but it's also has life insurance aspects and it has disability insurance. It's a guaranteed progressive benefit that keeps up with the cost of living. It covers or will cover about 97% of the elderly. It is not means tested and it enjoys political support, although there are many people who have suggested changes to the program. Benefits are modest by international standards, so compared with other high-income countries, our benefits are quite low. They average in 2023 about $21,000 a year, which is just over poverty level. It's very important for lifting children out of poverty. It's important for lifting the elderly out of poverty, and most elderly beneficiaries rely on Social Security for a majority of their income. It also helps minorities and especially women through survivors benefits. However, the item here I'm going to spend the most time on is the last one. Relatively modest changes would place Social Security on sound financial footing. So these are examples of changes to Social Security over time. You know, it's passed in 1935, but it was lots of people were not so happy about it at the time, and it's been tinkered with in many different ways. It's 1965 they added Medicare and Medicaid. 1972 SSI. 72 they also introduced this automatic cost of living adjustment. 77 though, in the 70s they started realizing that there was going to be a funding shortfall. So they did make some changes, increase the payroll tax slightly, etc., in order to bolster the trust fund. So there is a trust fund for Social Security, but at that time it was just about down to zero. So in 1983, there was the Greenspan Commission. They basically looked ahead, saw the boomers, you know, the baby boomers moving through this system, and realized that they needed to make more changes in order to make this fiscally sustainable. And so they kind of did the right thing back then. This 1983 reform and the 1977 one started an accumulation of funds in the trust fund. Our pension system is a pay-as-you-go system. So basically current workers pay for current retirees. There's no huge you know, there's no box with your name on it with the amounts that you've put in. There is a trust fund though, which is intended to cover times when costs are greater than income. A fully funded system, on the other hand, is the pension plan that has sufficient assets to provide for all the accrued benefits it owes and therefore can meet all future obligations. The only federal pension system that I know of that's like this is the post office. And in order to be fully funded, a plan must be able to meet all anticipated payments to both current and prospective pensioners. So there's a large lump of money, a lot of asset accumulation here. To be eligible for Social Security, you got to work for 10 years. Your benefits depend on earnings, full retirement age, and when you take benefits, not on exactly what you put into the system. And your benefits do depend partially on when you retire. So if you retire at age 70, you can get a maximum benefit of about $2,000 greater per month than if you retire at age 62. It's paid for by this payroll tax by current workers. OASI is old age survivors insurance. When we say Social Security, that's what most people mean. There's also disability insurance. So together, employees pay 6.2% of their payroll. Employers pay 6.2%. And if you're self-employed, you pay the whole thing. And then there's also payroll tax for Medicare, again, which is divided between employees and employers, and self-employed pay the whole thing. And then since 2013, there's a Medicare surtax. All three of these, OASI, DI, and HI, they all have, HI is Medicare Part A. They all have trust funds. So two comments about the payroll tax. First is, economists view the whole tax as falling on the employee. They do not, research does not, show that the actual people paying are the half employee and half employer. Employers are simply reducing the wage they offer by the amount of the tax they have to pay. So this idea that it's divided in terms of, if you really look at the burden or the incidence of the tax, it's really on employees, according to research. And the second is that the payroll tax only applies to the first $160,200 of earnings in 2023. So there's this cap, and the cap is indexed and changes every year. Above the cap, you do not pay the payroll tax. So this chart on the bottom, which is from the CBO, looks at average lifetime Social Security taxes as a percentage of lifetime earnings by birth cohort and earnings quintile. So we have three cohorts here, the 1950s, 1970s, and 1990s. And we have the lowest quintile, the lowest 20% of earners, the middle quintile, and then the highest quintile. And you see that for the lowest and the middle quintiles, they're paying about 12%, but the highest quintiles is only paying more like 7%, and that's because of cap. They tend to pay a smaller share of their earnings in payroll taxes. So it is difficult to determine the progressivity of Social Security benefits. Again, within a generation, your benefits depend on the best 35 years of your earnings history. And a replacement rate is how much of your working income your retirement benefit will make up. So individuals with lower earnings get a lower benefit, but a higher replacement rate. Individuals with higher earnings get a higher benefit and a lower replacement rate. And in principle, there's this redistribution going on. However, because of the cap, which is very regressive, the system is less progressive than it seems. However, low-income people have lower life expectancy than richer people. So again, that makes it less progressive. But low-income people have higher disability rates, so they get benefits that way. And survivors of low-income people, so if you have a spouse of the low-income people who die, then they get benefits. So the bottom line is it's really hard to determine how progressive Social Security is. And this just shows these different replacement rates for very low earners. It can be up to 90%. In the middle here, it's more like 32%. And for high earners, it can be 15 or lower. The average replacement rate is 37% in 2023. So let's talk about population aging. From 1980 to almost 2010, the number of covered workers per beneficiary was about 3.3, but this is projected to fall, and to fall quite a bit, all the way till 2, due to population aging. How about costs? Well, in this chart here, which looks at Social Security and Medicare costs, so Social Security here includes what we call Social Security, but also disability insurance, and Medicare costs include Part A, but also supplemental medical insurance, which is Parts B and D. So you can see that from 1970 to about 2010, Social Security would cost about 4% of GDP. It is now about 5%, and it's projected to rise to about 6%. Medicare, on the other hand, started in 1970 at about 1% and has been rising really quickly, all the way up to 6% by by 2040. So these costs are rising. Why? Well, partially because of population aging. The number of beneficiaries is rising rapidly as the baby boom generation retires. Secondly, the lower birth rates that have persisted since the baby boom caused lower growth of the labor force and GDP. And third is just for Medicare anyway, increasing medical costs. So all these calculations give us a really good estimate of what the shortfall is. And projected Social Security costs, it's basically a one-time adjustment from now and until 50 years later. And now we're at 5.2% of GDP for benefits, and it's going to rise to 6.3. So it's basically 1 percentage point. This is basically, it's not that high, and it's manageable and it's understood. Medicare, on the other hand, is rising faster and is definitely has larger cost increases by 2040. So these charts here from the CBO show how much of the problem is due to aging. So if you look at Social Security 2022 and 2052, what you see is the increase in costs of Social Security are all due to aging. If you look at the major healthcare programs, aging is these dark lines, 1.3 percentage points as a percent of GDP, but there's also a lot of additional cost growth. So if you add both of the aging for all these entitlement programs, you get about 2.8%, and the additional costs for healthcare is 2.6. So it's a little bit more than half is due to aging. So let's now think about income and costs. So this is for OASDI, Social Security and Disability. This narrow thin line is income, non-interest income, and this is benefits, costs. And you can see that in 2010, they were about equal. Before 2010, costs were below income, but after 2010, we're in a different world where costs are higher than income. How is it being paid for? We are drawing down the trust fund. But what's going to happen in 2034 is that the trust fund will be depleted. And in that, what happens? Well, by law, benefits will drop to whatever income is. So this is the dot here is scheduled but not fully payable benefits. Under current law, the default is that scheduled benefit payments will be automatically reduced after Social Security's trust funds are exhausted. So if politicians refuse to do anything and just let this go, that's what will happen. Alternatively, they could make changes to the program. And this is the same graph, but for Medicare Part A, hospital insurance. It also has a trust fund. It's a little bit later. The default will kick in by 2031, but it's the same scenario. So this just gives you an idea about the trust fund. And the one we're going to look at here is this blue line. That is Social Security, OASI. DI is different, disability. And then this is hospital is red. But anyway, let's just look at the blue. So you can see 1970 to about 1983, the trust fund was decreasing. Then we had those reforms where they were, politicians actually kind of did their job, looked ahead and reinforced the trust fund. It grew until 2010. And since 2010, it's being drawn down. And it's going to be at zero in the estimate now is 2034, because 2033, that's when full schedule benefits are expected to be payable until. This is just showing the trust fund going going to zero, starting in 2022. In 2034, it gets at zero. And then this is unfunded obligations, which again, aren't going to happen because those benefits will be cut in the default scenario. And then over to the right, it just shows that these are all estimates. And so if you follow this report every year, like I do, every year, all the numbers change, you know, the year hitting zero, sometimes it's 2033, sometimes it's 2034, sometimes it's 2035. Anyway, these are all projections. So how big is the problem for Social Security? Well, for the solvency problem and this long-run sustainability issue, there are lots of reform options. We've already seen it's sort of a manageable, it's a manageable amount, but and there are lots of options, but the longer we delay, the bigger the adjustment is going to have to be. So for instance, you know, take me, I'm still working now, I'm still paying the payroll tax. By 2034, it probably won't be. So if they wait till then, they're going to have much bigger tax increase and or benefit cuts than they would now. And it is, again, for politicians who don't want to deal with this whole thing, it's perfectly possible to do nothing. Just let the benefits be cut automatically across the board by about 20 percentage points when crunch time comes. Again, the long run sustainable, fiscal problem is really healthcare. A lot of the problem is the fiscal problem is population aging, but the other half is due to additional healthcare costs. Why are some people not thrilled about Social Security and the rate of return that they get? Well, the rate of return is how much you gain in retirement for each dollar you gave up as a worker. It's supposed to functionally be an income replacement formula on your highest 35 years of earnings. But your benefits are not, again, based on what you put in, but on this formula, your wage history and longevity and everything. Paying taxes for many is less of a tax and more of a forced savings investment with a bond-like return, or you can think of it as a form of insurance since it pays a monthly benefit no matter how long you live. And this rate of return is going to depend on many factors. Younger people are going to have lower returns because they will have paid the highest payroll tax rates of all age groups. Married couples do better. Longevity matters. If you die young, you're basically funding the benefits of those who live longer. At the same income level, females can have higher returns on average than males because they live longer. Lower income workers come out ahead because of the progressivity and when the rate of population growth is high, there are many more workers per retiree and the rate of return can be higher. And there's also a windfall gain for the first generation in the pension system. So first monthly payments began in 1940. And the first person collecting monthly benefits was a Vermont woman who worked for 3 years under the Social Security program and retired at age 65 in 1940. She lived to 1975, died at age 100. She contributed about $25 and collected almost $23,000. So that is quite a rate of return. Again, the rules were different back then also. So this is the rate of return to Social Security, and you can see it was extremely high for those born in 1875, but these days it's down very, very low. So our kind of pay-as-you-go pension system, in other words, current workers paying for current retirees, this first generation gets a free ride, sort of a windfall gain. And later generations can do well, but in general have much lower rates of return. However, it's hard to change the system. It's hard to end this system. If you really wanted to get rid of it entirely and have a more asset-based system, the last generation would pay taxes, but would get no benefits, right? And you've paid in your whole life. So how much money would it take to sort of buy out this system? This is the estimates from the Social Security Administration and be about $22 trillion. This is the implicit debt of Social Security. So who bears the cost of this transition to lower fertility and population aging? Well, basically every generation is getting a benefit of a certain amount, and current workers have to pay for it. That's the law, unless legislation changes the rules or unless our default scenario kicks in. So this is really a political issue. We're now seeing serious proposals for cuts in benefits in response to lower fertility and population aging, or they could increase taxes, or they could do both, or they could change the rules, or they could just go with the default. In other words, although these are the rules of the game, you can't, this idea of defined benefit that is owed to you cannot be taken too literally, because things can change. So what are some options for restoring fiscal balance? Well, one way to think about it is, what are some principles? And this is from the Center for a Responsible Federal Budget. Strengthen Social Security as soon as possible to extend the life of the trust funds. So phase in changes, which would mean you'd have to start soon. Support the most vulnerable, avoid these across the board, default benefit cuts projected under current law. Promote stronger economic growth and productive aging. So remove work and savings disincentives. Rely on honest accounting and avoid gimmicks and cost shifting. So by this, they're referring to one of the recent proposals, the Biden administration and Congress, Social Security 2100, which would only work for a few years, basically. And don't criticize others if you don't have your own solutions. These are examples of possible changes that could be made, and the amount of money that would be saved, and the percent of the shortfall that would be taken care of. You could increase the payroll tax. You could eliminate the taxable minimum completely, the cap, the threshold. You could cover more people. Subject cafeteria plans. So these are plans that are not currently subject to the payroll tax, like fringe benefits, for instance. You could, on spending, you could grow initial benefits differently with different indices. You could reduce benefits for higher earners, initial benefits for higher earners. You could increase the earning years to include from 35 to 40. That would probably, for a lot of people, include zeros, which pulls numbers down. Change the cost of living adjustment to a change CPI, which would reduce the cost of living adjustment. You could raise the retirement age. You could index for life expectancy. And then these are more, the neat thing about this, if you go to this website, there's this interactive tool. You can start playing with this yourself. So that's interesting. You could just reduce benefits going to higher income people, not just initial benefits. You could broaden the tax base, have policies that would increase the number of worker taxpayers, raising labor force participation, raising fertility, increasing immigration. Increase the dollar cap on contributions, earn a higher rate of return by investing the trust fund in the stock market. So this has been proposed a lot. Currently, what happens is the trust fund is all invested in government bonds, T-bills, which has a very low rate of return. It is also basically not risky. And so what about investing part of the trust fund in equities and earn a much higher rate of return? Of course, the issue there is maybe, because we all know that the stock market doesn't always go up. And the question is, are we better off investing at a higher average rate of return, but with much higher risk? There have been a lot of proposals over the years to privatize partially or totally Social Security. Martin Feldstein in the 1990s had, mandatory private savings accounts. President Bush had a proposal that died in 2005. Romney and Ryan in 2012 supported privatization. Let younger Americans have a voluntary choice of making their money work faster for them within the Social Security system. And then, so what are some problems though with privatization? Well, first of all, we've got this implicit debt. Like, what are you going to do with current retirees? How are you going to work that? You're going to pay them from the general fund. One thing that has been proposed a lot in the past is, gee, we had this huge trust fund surplus. Why don't we use that to switch systems or partially? Of course, now that's really not an option. That's why I have it in highlighting, because we don't have much of a surplus to go. It's risky, and what would happen, if people don't end up with enough money in old age? Well, government probably have to do something anyway. So just kind of to end back to this relatively modest change would place Social Security on sound financial systems footing. What the Center for Budget Policy and Priorities recommends is increasing the payroll tax, and partially because the tax base has eroded so much since the last time it addressed solvency in 1983. Lots of headlines in Social Security recently, because we're coming to an election year. Unlikely that anything will happen in an election year, I would say. And just acknowledgements, I would really like to thank Gretchen Donahauer, Ron Lee, and Andrew Mason, and all the members of the NTA network in these 70 countries that have done so much work on all this. And here's some references if people are interested. So thank you very much. And I guess I should stop sharing, right? Yes.
Well, I'm sure there are going to be lots of questions here. I think the first one that came by was Roger, but feel free, anybody, or Hillary, if you want to try and watch over who speaks next.
So I had a couple of questions, and one was when you were talking about comparing different countries, and particularly you're talking about India and China and how their populations were changing and all that. Could you give us an idea of how these data are gathered and how the numbers are crunched? Are they equally reliable for different parts of the world, and how are these countries incentivized in some way to report accurate data?
Well, these are a lot of the numbers here. The ones in the beginning are from the United Nations, and you can look up, it's called World Population Prospects. So the United Nations works with the statistical agencies in all these different countries, and they are supposed to report in a standardized way to the United Nations for all of these types of projections. As to the quality of the data, I'm sure it varies, but that's the way. It is a standardized process, and it's the same thing with the NTA network. They're working with statistical agencies in 70 countries. They actually produce estimates for 185, but for the extra countries that they're not working with directly, those are all done by modeling. Mm-hmm. But in general, it's working with the countries themselves and asking them to report in a standardized way.
So then they have to be trusted to answer correctly. And then, so what are the incentives there for them to do that?
Well, if they're too far off, people will figure that out.
Mhm.
That's one incentive. But it's, I don't know that there is a real incentive other than trying to, trying to get it right for their particular country.
Mhm. Okay.
I think Joan had a question next.
Yes, I want to focus on the cap. It's always seemed to me the worst part of the whole system. And I don't understand why the cap was originally instituted. What good does a cap do for anybody except the rich people?
Well, I don't actually know the answer to that, but I can give you my guess, which is that in order to be politically palatable, compromises are made, and this is one of them.
So in other words, the people with the most power have the most money, and they're the ones who have to pay a smaller proportion of their income.
That's correct. But again, I wasn't there when this decision was made,
Right.
but that's sort of the obvious guess.
Isn't it obvious that eliminating the cap or greatly raising the cap will solve the problem?
Well, it's all part of the problem. Yeah. And you can look at all those tables and see what part of the problem, if Biden has talked about increasing it to 400,000. So yeah, it depends how high. If you get rid of the cap entirely, that's a different story than increasing it to 400,000, for instance. But yeah.
Thank you.
Okay, I think Joe, you were next.
I am next, but if there are any other mine's going to be on an earlier topic. So if there are any more questions on Social Security, I'd like to defer to those before I go into something.
Well, I'd like to ask something about the cap, following up on Joan's question. Am I correct that the earnings that people have that are actually taxed are earnings that are made from salaries, but not from stock options and IPOs and that kind of thing?
It depends. Some forms of compensation are taxed and some aren't. So for instance, one of the kind of untaxed benefits is employer provided health insurance, right? But I believe, I don't know 100% the answer to your question about stock options, but my guess is that would be taxed. But yeah, it's not just labor income. It's also other kinds of income.
Okay, Sarah?
Thanks again, Martha. This is so fascinating. My question has to do with the gap possibly between all this great data that you all produce as you study what's going on and the policymakers. We have an elder action group, but we're sort of constrained in terms of how political we can be. And of course, this seems to be a political can of worms. However, I heard you talk about several things at the end that talked about ways that we might, speak to legislators and do things to say, here's this data from this reliable source. What are you doing in the U.S. Senate or in the wherever to make changes, and how will that benefit me and my grandchildren or whatever? Do you feel a frustration that your data goes out and you don't see the change you would hope to see in the world?
Well, I think different economists have different attitudes towards that. I mean, some people are completely theoretical, and they do their theory and they talk to each other and they publish in fancy journals, and that's one way to go. There are other people who really would like their results to be used. And I think economists actually have changed a lot, at least in the time I've been in this profession, towards, for instance, now most people publish in a fancy journal, but then they have an issue brief that is much less jargony and understandable and is picked up in the newspaper. And they're writing a lot more op-eds and they're blogging. And so I think people are becoming more policy active than used to be the case, 50 years ago when I first started all this in this profession. I personally, one of the jobs I liked the most was working for the legislature, because I was actually at the California State Library. I was in the California Research Bureau. And that to me was fascinating. We would be given, projects, and then we would testify our results to the policymakers, and it was really interesting. Sometimes they totally ignored what you told them. Sometimes they took it and ran. Sometimes they tried to suppress the report. But, there's the whole gamut. And sometimes it is really frustrating if you're working in government when your reports are repressed because somebody doesn't like the results. But anyway, so it runs the gamut. And I think, but I really enjoyed working in contact with the legislature like that, because I felt like, well, at least it wasn't being published somewhere, and who knows who read it. At least there I was, testifying in front of these folks, and they can't say they didn't get the information.
Well,
whether or not they choose to use it is another story.
The university would seem to be, and maybe Joan will second the motion, but the university would seem to be a forum that would give you an opportunity to get your information out. Do you feel that that's the case?
Oh, definitely. It's interesting. Again, I don't think that this was so much the case, 40 years ago, but now when your paper comes out, there's usually press releases, and my department always writes blurbs and, connects people to the research in a way on the internet that was not possible before. It was just in some journal somewhere. And maybe some reporter picked it up, but not often. So I think economists are much more active than they used to be, and definitely the university is part of that story.
Yeah, thanks very much.
Oh, did you still have a question?
I don't.
Yeah, I had one more question. I worked my whole career in the California public schools, and so I'm a member of STRS, State Teachers Retirement. And one thing I've always been glad about, well, two things. One is that they have professional economists or investment people who know how to take care of the money and try to make it grow, so that it's not just in T-bills. The other thing I've been very glad about is that it's a state agency, and it is not, the money's not in the hands of my local district, which would have lost the money years ago. But I just wanted to ask if you could compare how these public retirement systems have fared relative to Social Security.
So you mean state and local?
Well, compared to the national Social Security system, which it sounds to me like they have not taken advantage of any opportunities to invest, compared to STRS or PERS, have our public retirement systems done a lot better?
Well, it depends. It depends which systems you're looking at. In other words, there are a lot of cities, for instance, the problem with these public pension systems in many cities is that politicians have a very short time horizon, and it's politically very advantageous to offer generous benefits. It works for them while they're in office, but it might not be fiscally sustainable. And so there are many public pension systems that are in real trouble because they overpromised something that was going to happen in the future. So you're absolutely right that some systems, they have really good controls over this kind of thing. They have good actuaries, they have good people investing the money, and it all works out great. But unfortunately, because it's a political thing, I mean, I'll just give you an example for the state of California. They have this thing called airtime, which means that you can, and I did it, why not? I mean, anybody would. You can buy 5 years of retirement benefits. It's a one-time payment. And then for the rest of your life, you get an extra five-year bump on your benefit. Now that, why was that the case? Because at one point in time, the state needed money and they wanted everybody to pay for the thing, so they would have this bump of money at that point in time. But in the long run, it's not a good policy at all. I mean, I took advantage of it. Anybody would. So it's very easy to offer benefits that have short-term gains, political gains, but long-term financial losses. And that's the problem. So when you read about, especially cities that are sort of under the water with their pension systems, that's often the reason.
Okay, thank you.
Yeah.
Roger, I'd like to comment more. This is a good part of what I did for a living, following these pension systems. I can tell you that PERS just announced their overall funding, and it was somewhere in the mid-70s. In other words, 75% so-called funding, as Martha explained it. There are some places on the East Coast that are almost 100% funded. PERS segregates its funding by agency. In other words, and BART, which is my career, would probably still be in the mid-90s, whereas another agency might be 40. So it depends. And you can't even look at PERS as a whole. You have to look at individual agencies. That's how their actuaries track it.
Okay.
Illinois, I haven't seen the number lately, Martha, but I know it's something awful, like 20-30%, if that, 15.
Yeah, I was going to say Chicago's in bad shape too.
Worse than bad.
Yeah. So and quite a few places in California too, by the way. It's not just Illinois. So it's just a political. It's kind of like, when we had that big bump in income in the end of the 90s, and what did Gray Davis do with it? In my opinion, he should have made a lot of one-time investments, things like upgrading the computer system, for instance, or something like that. But no, what do they tend to do? They tend to make commitments that are long-term. So for instance, in that case, it was class size reduction, which costs a lot of money over time. So you have to be really careful with politicians when they're making these choices, because they have a short-term horizon, and the policies that they implement often come to roost in decades later, and then there's a problem.
Well, Gray Davis got terminated, so I guess maybe
he did get terminated, but class size reduction didn't. I mean, I have nothing against class size reduction. I'm just saying it's a long-term policy that, was instituted because they all of a sudden had this windfall gain of money, and listen, at the time I thought, oh, wow, I hope this works out in the long run. But anyway.
I still have another question. I came into this thinking that you talked about population growth, and you talked about fertility. And the first thing I thought of, well, those the medical reasons for the change in fertility rates. But as your talk went on, I started making a list of other things like people marrying later, choosing education, and delaying childbirth because of that. Religious reasons. You even remarked that the addition of the increase of the Hispanic population in the United States, they have higher fertility rates for partially, I'm supposing, because of their religious choices. So far, so good?
Yeah.
Okay, so my question is, why don't we see that in Italy? That's
Well, I guess, yeah.
They're just as Catholic as the Hispanic
Oh,
country.
they're not. They're
Maybe
nominally
not,
Catholic.
Joan.
They're
Yeah,
not.
they're nominally Catholic, but I don't know.
Only
I-
nominally. Okay, I
Yeah.
think you might have
They're
answered.
not that religious. The same in France.
Yeah, that's right. All those
Ireland.
huge cathedrals with no parking lots. Nobody goes.
But you saw what happened in France when Macron successfully tried to raise the retirement age. You know, so far he's got his way, but it's been bloody. Sarah and I were there to witness it.
Yeah, well, the French, they have this idea which is called an acquis, something that's acquired. So anything that's acquired, getting rid of it and going backwards is just like against their religion, talking about religion. And so, yeah, they really believe, you know, like I said, can't take defined benefit too literally. Well, they do take it literally. And so, yeah, it's a, and you know, I was an exchange student in France. The family that I live with, the father retired, full retirement benefits at age 50. He is now 95. So he retired for 45 years. I mean, he did start working at age 15, but that's only working 35 years and he retired 45. You know,
And he got
worked
5
for-
weeks a year of vacation probably too.
Oh, absolutely. So yeah, I mean, there's a good example of very generous benefits that don't pan out really fiscally all the time. Yeah, so it's very easy to promise benefits that aren't gonna, you know, come to fruition until the future if you're a politician. So that's why the Greenspan Commission in 1983 was so amazing. I mean, they actually looked forward, they actually did their job, you know, and it's worked for 50 years, which is amazing. I can't see that happening now, but who knows, maybe I'll be surprised.
I got to ask one more question. Another different topic. Too much of what you talk about is, you know, what I did for a living, and so and studied in college. You talked about consumption, and consumption is measured in US dollars.
Oh, well, yeah, in the US, yes, but
And in,
for all of these different countries, that's a whole, yeah. Combining all this statistically is a real project.
yeah, exactly. I mean, their exchange rates come in. How do
There are
you
exchange rates, there's inflation rate, all sorts of
Yeah, I
different
was
things.
thinking, how in the heck do you do that?
It's a huge that's why, you know, that little graph there that shows the aggregation of 185 countries is pretty amazing. And again, it's a team of hundreds and hundreds of people that are working on this thing. And you know, Hal Runley and Andrew Mason they've been working on this forever. So I was a PhD student at Berkeley, and you know, Ron was one of my professors, and this thing has been going on for decades, and they've grown this project to what it is now, which is, you know, it's just quite, if you read the article there that I mentioned, six important things about population growth or something. The sort of aggregation of all of this information into one graph is just, to me, it's kind of mind-boggling, but they've done it, and they are working constantly to try to get better numbers and make sure the numbers make sense, and, you know, check them against each other. So US immigration from Mexico, well, we have our numbers, but we can check with Mexico also. I mean, they cross-check all sorts of things. It's amazing. And you're right. I mean, inflation rates, exchange rates, purchasing power, the whole thing is quite a project.
Any other questions here? Well, let me then conclude. First of all, Martha, thank you for the time. I know that you're traveling now and you have other things on your plate. We really appreciate the time. As a personal comment, if I would have had you as my economics professor, I might have changed what I did in grad school.
Oh, well, there you go.
A little bit late
Okay.
for you now.
Well, never too late.
But,
Thank you. Thank you.
just
Thank
wanna
you very
Thank
much,
thank
you.
Martha.
Thanks for inviting me.
Thank you. Bravo, bravo.
Let us know when you come visit. I owe you dinner.